Welcome everyone, thanks for joining us for this segment, which is Part D, prescription drug plans. We're going to go over a couple of details about what is prescription drug plans, what do they cover, the differences between prescriptions on Part B versus Part D, how to obtain these prescription drug coverages, and a few other details. First, we're going to go over some of the simple details of what is Part D. What does it refer to when we say prescription drug coverage? First, it's going to cover your prescriptions. We know that Part A and B of Medicare is going to cover your health services and your doctor's visits. What we're going to do is we're going to go through and cover some of the details of what is actually offered by the prescription drug plan, because these are offered through insurance companies, private insurance companies that we represent as independent agents. Now, some of the things that are not covered under Part D are non-over-the-counter prescription items. So what that means is if they are over-the-counter and you do not need a doctor's prescription, you're not going to be covered underneath Part D. These things, such things are vitamins, cough medicines, certain non-prescribed allergy medications that have been removed from having the requirement of your doctor filling out a referral for you to get that. Now, it's important to know a couple of details. Part B of Medicare, remember that covers your doctor's visits, also covers certain prescriptions. Now, Part D does not cover these prescriptions. This is going to be covered under Part B. Now, these are prescriptions that are not administered by yourself. So if your client has to go to a facility to use as an outpatient and get these prescriptions administered to them, this is not going to be covered by Part D prescription drug coverage. They also include the use of durable medical equipment such as injectable prescriptions, are both covered under Part B. We do have a quick reference guide that you can reference to as well in case you need to know more about Part B prescription drug coverage. But other than that, the rest of your prescriptions are going to be covered by your Part D prescription drug plan. There's a couple of ways to obtain your prescription drug plan. For your clients, they're going to be able to enroll into a standalone prescription drug plan. They can also obtain it through a Medicare Advantage plan. And in most cases, states will have state-specific plans that will offer some type of subsidy or other type of prescription drug plans that are able to be purchased as well. Okay, so we've covered some of the basics on how to obtain prescription drug coverage. Now let's go over a couple of details of when to enroll. Now, obviously when somebody turns 65, they have their initial coverage period, and that's when they can make a decision whether to stay on original Medicare, join a Medicare supplement, or a Medicare Advantage plan. Either way, that's a great time for them to go ahead and enroll into their Part D plan. Now, some of these plans have premiums, deductibles, and copays, so let's go over a couple of those details right now. So for example, the plans that have premiums will go ahead and charge a monthly plan premium towards your client. These premiums can be paid in three different ways. They can have it automatically withdrawn from their account, they can have a direct monthly bill sent to their house every single month, or in this case, which is very unique, they can actually have it withdrawn from their Social Security by having a Social Security deduction. So if your clients qualify by having credible coverage, which means they have a current plan that covers their prescription drugs that is at least as good as what the Medicare plans offer, they are exempt from purchasing a prescription drug plan. The two groups that come to mind right away are individuals with veterans assistance and also those who are on group plans. This means that they are entitled to have an exemption of purchasing a Part D prescription drug plan, which saves them from the penalty. Now, if an individual does not have credible coverage, they would be subject to a penalty. This penalty is calculated by multiplying 1% of the national base premium, which right now in 2017 is $35. Now, you're going to time that number, 1%, by the number of months not covered. As a quick overview, let's review how a penalty is assessed. First, what Medicare is going to do is they're going to multiply 1% of the national base premium of a normal prescription drug plan. They're going to times that by the number of months that the client was not covered, and they are going to round it up to the nearest 10 cents. Once you get that number, you're going to add it to the monthly premium of whatever plan they decide to enroll into. Now, it is not our job as agents to do all the calculations. That's going to be done with Medicare, but if you are going to help out a client, just be leery that you don't want to guarantee any numbers, because you would have to check with Social Security to see if they are either exempt or if there's other programs that could help them cover those penalty costs. Okay, so we just finished talking about the penalties that your client couldn't face. Now, let's go on to actually what the formulary is and how prescriptions are covered under this Part D plan. Now, all Part D prescription drug plans use a formulary. That is a list of drugs that are covered from a specific carrier. All carriers have the right to choose what prescriptions are available in what categories. We can get into more detail about that later, but just so you know, most companies have what's called tiers 1 through 5. Those tiers will range depending on whether they're generic or brand name. For example, the carriers follow the specific guidelines of preferred generic drugs. There's also preferred brand drugs, non-preferred drugs, and specialty drugs. Those are the typical. So these 5 tiers typically follow this structure. 1, preferred generic. 2, generic drugs. 3, preferred brand drugs. 4, non-preferred drugs. And 5, specialty drugs. Now you're going to want to have your client check each and every one of the formularies for different carriers because every carrier can designate them at a different tier. Now, once you figure that out and your clients are on their way to pay for their prescriptions, they're going to hit certain stages along the way. Now, the first stage that they will incur at the beginning of every single calendar year is what's called their deductible. This is what they pay first prior to having the insurance company step in and pay their portion. Be careful because some prescription drug plans may offer a different deductible at different tiers. Some may require a tier 3 drug to have a deductible versus having a tier 1 or tier 5. Please check with every carrier to see what their specific formulary looks like. Once this deductible has been satisfied, your client now moves into the initial coverage. That is where they're going to incur the copay amounts. This means that the plan pays the majority of the cost and the client pays a specific portion or a specific copay depending on its tier, whether it's a preferred generic or a brand name drug. Now both your client and the insurance company are going to continue paying their portions until they reach $3,700 combined out-of-pocket costs for prescriptions. Then your client is going to enter into what's called the coverage gap. This is commonly known as the donut hole. Now, in this coverage limit, in this stage, your client is now going to pay 51% of generic drugs and up to 40% of the brand name prescription drugs. Now, if this gets expensive, have your clients call the manufacturers. Manufacturers do offer discounts through the coverage gap at this point. Now, your member is going to pay their 51 or up to 40% for the prescription up until the number 49.50. This is what's called the donut hole or the coverage gap. Legislation has been trying to close that coverage gap limit over the next couple of years. As of 2017, the coverage gap starts at $3,700 and ends at $4,950. Once your client has reached that $4,950, that is when they get a little bit more relief. It's called the catastrophic coverage. They've been paying a large amount of prescriptions up to this point, and now they're going to let the insurance company take over. The insurance company is going to pay the majority cost for that prescription, while your client is going to pay 5% of the cost, or typically what will happen is they will pay anywhere from $3.30 for a generic prescription drug up to $8.25 for a brand prescription drug in the year 2017. Okay, so hang with me. I know we're going through a lot. We just finished up talking about the different stages that your clients are going to come across when they start paying for their prescriptions. Now, one important thing to understand is what we call the TROOP. That is the true out-of-pocket cost. That is the total amount paid for by your client for all deductibles and copayment amounts. It's important to understand that amount because every client could hit that true out-of-pocket and that coverage gap at a different time. And we want to understand what their financial situation is and how else can we help them. A couple of ways we're going to talk about how we can help them out is simple. How are they going to get their prescriptions is typically the easiest way to manage that cost. Meaning there's 2 ways to usually get their prescriptions. Mail order, which most companies do for tier 1 and tier 2. They don't usually mail order prescriptions for anything like narcotics or any other type of strong medications. So it's very important to understand that if they do have these generic prescriptions, they're able to send them over the mail. The second option is going to the pharmacy. Everyone knows that they can run to the pharmacy. However, one very important thing to note is that clients must go to the pharmacy that is in network with that plan. You may be able to have a client go out of network or to a non-network provided pharmacy. However, they're going to incur a higher cost associated with their copays. Some pharmacies are what's considered preferred pharmacies with specific carriers. Please check every carrier to see if they have any preferred pharmacies that offer lower prescription drug costs. Now, after enrollment, as soon as that application goes in and your client becomes effective, their first 30 days of prescriptions, if they are currently on prescriptions, should be covered through the company with no questions asked. Now, if they have a long-term care prescription, which means it's a lot more of a serious prescription, then they're going to get the first 90 days given to them without much question. This allows the company, whether you enroll them at the beginning of a month or at the very end of the month for the following month, it allows the carrier enough time to go through the proper channels and ensure that that individual is going to receive that prescription. Now remember, like we talked about before, every carrier has a list of prescription drugs on their formulary that they're going to pay for. Not all prescriptions are always covered by every carrier. That's why it's important to do a needs analysis with your clients. If, for whatever reason, your client's prescriptions require a prior authorization, that'll be done within that first 30 days, and they will also be able to receive that prescription for that first 30 days. In some cases, the carrier may require that your client do what's called step therapy. That means that they simply try a generic drug prior to being issued a brand name prescription drug plan. The carrier wants to know, is it possible for your client to use a non-preferred drug or a less expensive drug prior to them actually paying for that brand name, more expensive prescription drug? If all that fails and the formulary does not include your client's prescription drug, there are certain instances where we're able to file an appeal, or what's called a formulary exception. And that is when the doctor is able to send documentation into the carrier and say, look, there is no alternative medication for this client, whether it be because they have allergies or because they just don't have another prescription that covers that specific symptom. They are able to get that overturned by sending in a formulary exception to the carrier. Now, with all this talk about prescription drug costs, it can get very, very pricey. Let's talk about a couple of ways on how you can help your clients save money. First, let's see if they actually qualify through Medicaid or low-income subsidy through Social Security. That is going to be the largest benefit for an individual and have the lowest copays available. Second, like I mentioned earlier, is the pharmacy choice. Are there certain pharmacies that are in network with the carrier that offer lower prescription drug costs? If a client is able to do mail order, I highly suggest they send their prescriptions via mail and get that sent to their house. It's less hassle and less expensive. There are a couple of other companies out there that are going to help out with the lowering of the prescription drug costs. There's programs out there such as GoodRx, and there's other companies that are able to help lower the cost of prescriptions by doing research and finding manufacturers' coupons that'll actually get you a lower cost for your client. There's a lot of additional resources out there. Please check back with us if you have any questions on some of these resources. The last option that I think is overlooked is simply by not using your insurance card. I know this sounds counterintuitive, but honestly, many times you can go to your pharmacist and actually have the pharmacist recommend whether it's going to be cheaper on your insurance or off your insurance. They can run it both ways. The reason why I suggest doing this is because in many cases an individual can get a lower cost prescription, whether it's within a couple of dollars, by not using their insurance, and save in the long run by not having that count towards their maximum out of pocket or their troop. Remember, any prescription that is billed to the insurance will help a client get to that $3,700, and they will hit that catastrophic or the donut hole, which results in a higher prescription drug cost. Many generic prescription drugs can simply be purchased without even presenting the insurance card. Please look at our website. Please give us a call if you have any additional questions on the prescription drug portion of it. Now that we've gone through some of the details on that, you'll be able to educate your clients on why they should obtain a Part D prescription drug plan in a timely manner instead of waiting, and how to effectively make a decision on which route they want to enroll into a prescription drug plan. Thanks again, and we'll talk to you soon.